Well, good evening, and thank you for inviting me to this forum. I was asked to participate tonight because of my service on a formal state commission in New Hampshire, the guys to the north, a commission that was tasked with exploring the health and environmental impacts of wireless radiation. It seems to be pretty relevant to what we're talking about tonight. It's important to note that at the time I joined the commission, I did not believe that low-level wireless radiation exposure, the type you get from your cell phone or a cell tower, was particularly harmful. That was the conventional and is the conventional wisdom for people working in my field, and it's a viewpoint that's routinely reinforced by industry, as Dr. Davis just mentioned. However, my beliefs about the safety of wireless radiation soon changed after beginning to work with the commission. So there are two key takeaways that I'm hoping you'll get from what I'm about to say. One is that low-level wireless radiation is harmful to both humans and the environment. And the second takeaway, and I'm saying this as a radio frequency engineer, but it's more positive, my second message, and that is by implementing more protective designs and ordinances, we can continue to use our digital devices with far less harm than the harm we're being exposed to today. So I'll go now into my slides, which I'm using to provide references for some of the topics, and you should already have access to them. So I'm going to have to fly through the material because I'm going through over a year of a commission finding, and I'm going to be doing it in a relatively short period of time. So please bear with me as I try to speed through my material. So what I want to do next is share my slides. And here we go. It should work. I'm assuming that you can see my slides right now. Okay, so the first question I would like to address is, why was the commission that I served on formed in the first place? Well, this happened back in 2019, and the legislators were hearing from their constituents that we're being harmed by wireless radiation, and we have the scientific evidence to prove it. And these same legislators were hearing from industry that no, there's no harm whatsoever, and you need to put more facilities in your state in order to be financially competitive. So what the legislators did is they formed a commission. And that forming a commission in New Hampshire is not a small deal. You have to come up with a bill, you have to get it approved by both houses of the legislature, and get it signed by the governor, which they did. So that's why they formed the commission. And then as far as who served on the commission besides me, we ended up with 13 commissioners, and these were independent people. None of them were paid except for the people who were working for telecom. We had some 3 individuals that were associated with telecom on the commission. And so they were paid, but the rest of us weren't. We were doing it free as volunteers. And I believe, had a great deal of independence because of that. So we had the expertise, and that expertise was spelled out in the legislation. And by the way, all of these hyperlinks are active. So if you get my slides and want to find out about anything that I'm talking about that's hyperlinked, just click on it and it'll bring you to the right page. And so we had backgrounds in, medicine, like 2 physicians, physics, toxicology, electromagnetics, epidemiology, biostatistics. We certainly had the right expertise to answer the questions that were being posed to us as a commission. Well, what were those questions? Well, one of them you heard from Dr. Davis already, and that is, why does the insurance industry recognize wireless radiation as a risk but won't insure against it? That certainly is a red flag. Why are there hundreds of peer-reviewed, perhaps thousands of peer-reviewed studies showing harm, and they're being ignored by the FCC in setting limits? Now, these are some of the questions. I won't go into the rest of them because we're limited on time, but we were posed with a number of questions, and we were able to answer them, and you'll be hearing more about that in just a few slides. So the sources of information, this is how we did our study. We did a peer-reviewed literature search, as you'd expect. And so we also, I have to acknowledge that not all peer-reviewed literature is, it contains the truth. So a big part of what we did, and that's where the commission vetted part comes in, was to look at the information that we had, look at the peer-reviewed journals that showed harm, and determine whether or not they were viable. Were they quality journals? And I worked with our college librarian who had a PhD in library sciences to make sure that anything that we used in the commission was from a quality journal. We also invited people from regulatory agencies, the FCC, the FDA, the EPA. Please come meet with us and help us understand the risks and understand how the regulatory process with regards to radiation exposure. Well, the bottom line is nobody showed up. We had email exchanges with them. They sent us to websites, but they did not answer the specific questions that we asked them. So that's we tried to bring them in, and they didn't come. So we also brought in outside experts, worldwide experts recognized for their understanding of the relationship between wireless radiation exposure and health. And of the 9 experts we brought in, all 8 of them, said that, oh yeah, there is harm, and they documented what that harm was and how they came to the conclusion of harm. The one outside expert who said, no, there's no harm whatsoever, was the one presenter from the telecommunications industry. And by the way, that was the only presenter that was paid to come speak with us. All of the other speakers came on a voluntary basis. So those are the sources of information. In terms of the outcome of our studies, peer-reviewed literature search, we did identify hundreds of top-tier publications that showed harm from low-level, and I want to stress that, low-level wireless radiation exposure. That's the type of exposure you get from your cell phone or from living near a cell tower. So hundreds of them that did show a significant health risk from being exposed. And then as of 2020, and by the way, the person who wrote this review that's linked here is Dr. Henry Lai who was mentioned earlier. And the vast majority of those peer-reviewed publications showed harm from exposure. In particular, one of the harms, and something that demonstrates the mechanism for that harm, is that you have an increase in free radicals which create oxidative damage in your cells. And Dr. Brown mentioned that, as did Dr. Davis. So the vast majority of those publications did show harm, and it showed an effect from exposure to wireless radiation. Now, these 2 bullets are very important because if you listen to people from the telecommunications industry, and I've heard lots of their presentations, their claim is that the only peer-reviewed journal articles that show harm are those that are cherry-picked from fringe journals. And what these 2 bullet points show is no, you don't have to cherry-pick. They're readily available, those articles from top-tier journals that do show harm. Just briefly mention here that, talking about the oxidative stress causing free radicals in your body, that leads to a host of diseases. And here are some of them. So what I've done here, again, you can take the slides and click on these links. And what they do is they show an association between the disease listed and wireless radiation exposure. This is just a very partial list. But what it demonstrates is that there is that association, and it's caused by oxidative stress, which leads to inflammation. Chronic inflammation can lead to cancer and the host of diseases shown. And I think everybody listening here realizes that these diseases that are posted, that are shown on this slide, are on the rapid increase in this country right now. So something else to point out, and this is something that the Commission was well aware of, is that this association between disease and wireless exposure occurred at exposure rates below the FCC limits. So that begs the question is, how were those limits determined? And now you heard this already from Dr. Davis, but I'd like to go over it again. I had to see this a few times before it really sank in. How were the current FCC exposure guidelines set. As you already heard, they happened back in the 1980s, and they were based on studies on 8 rats and 5 monkeys. And anybody familiar with epidemiology or clinical studies of any sort know that you want to get as many large an N as possible, as many subjects as possible. So here we're dealing with 13 animals. And there's a reference here that describes it in greater detail if you want to know that detail. So the assumption was that it's only heating effects that causes the problem. It's not the long-term chronic effects, which we now know is a problem. It's a problem that's not acknowledged by industry. And so because you're only looking at, or they only looked at acute problems in coming up with these guidelines, they only looked at studies that were an hour or less. Now, we're talking about the exposures that we're getting 24/7. To set those guidelines, they only looked at a 1 hour or less. So what was pointed out, and I'll just click through these in the interest of time, is that they took these animals that had been trained to push a lever to get food, and they put them in a room. They were food deprived. They put them in a cage and kept ramping up the electromagnetic fields that they were exposed to till the point where they could no longer perform that very simple task of pushing the lever to get food, even though they were starving. So they took that and declared that as being the upper limit for exposure. And then they divided that number by 50. In the case of workers, they only divided that by 10. But for the population in general, they took that upper limit, the point at which monkeys even got burns on their faces from the very high exposure, divided it by 50 and said, that's fine. That's okay for the public in general. This is why I wanted you to see it a second time, because it's just so important and it's so very wrong. So that's where those guidelines came up from. So if you hear anybody talking about FCC guidelines and, well, we're within compliance, this is what they're talking about. It's woefully inadequate. And that safety factor, they call it, of 50, that's not based on any relative risk. It's an arbitrary number. It's somebody said, well, let's use a number of 50, and that should be adequate. So moving right along, we as a commission were saying, well, what's going on here? How come the FCC isn't protecting us? And we came across this study. This is not from some conspiracy website. This is from the Harvard University Center for Ethics. And the title says it all. Captured Agency, How the Federal Communications Commission is Dominated by the Industries it Presumably Regulates. And then the quote there is also good. I really recommend looking at this article. It's actually a report, because it really documents what's going on. How could a federal agency that's out there to protect us ignore all this important information and ignore the harm that's clearly going on? So getting to finally the conclusions, and this is just an abbreviated list. We have a final report. It's 390 pages, but you can really get the gist of it in the first 20 pages or so. So it's got a link here. You click on it and you can get the report. And the first bullet is one that I don't think will surprise you based upon what I've said so far and the previous speakers. Wireless radiation, which includes 5G and Wi-Fi, poses a significant threat to human health and the environment. So you heard about that, how it impacts insects and flora and fauna. It's true. Electrohypersensitivity, called EHS, it's real. It's an illness that's caused by radiation, and it debilitates people. So if somebody has EHS, they cannot go into a room with an operating Wi-Fi or with cell phones in operation. They can't do it. It's serious, and it's real, and it's recognized by the ADA, Americans with Disabilities Act. But it's completely ignored by industry. When you talk to them about electromagnetic hypersensitivity, they say, oh, well, it's all in their heads. We as a commission found that it is not in their heads. It's real, and it's very serious. Also, there's a claim wireless communication is energy efficient. It's not. It's very inefficient, particularly when you compare it to wired communication. Wireless communication doesn't bridge the digital divide we can talk about that more, but if you put in high-tech 5G towers, that's not helping anybody. There are ways of doing it that will help people, but going wireless, particularly going 5G, does not help because the people you're trying to help can't afford these expensive phones, but there are things that they can afford, and we can talk more about that later. And then wireless communications is not nearly as secure. Wireless is completely insecure because your signal is going everywhere and making it accessible to people. And if you have access to somebody's cell phone signal, you can decode it over time. If you're going through a wired network, it's very, very challenging. So if you want security, do not go wireless. And finally, what we concluded in the commission was this is not really a scientific issue. The science is crystal clear. Wireless radiation causes harm and significant harm. So it's become that political issue, an economic issue. And so that's where we left it as a commission, is we can spell out the science, we can make it available to people, but we can't change some of the rules that are going on in Washington that were raised earlier. So that concludes my presentation, and I thank you for your attention.